If you're currently pregnant and preparing for childbirth and wondering how you take care of this after having a baby, we're going to discuss all of the details in this video of how to perform peri care and all of my tips and tricks as a labor and delivery nurse of over 8 years. Welcome to the MamasteFit YouTube channel. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be discussing all of the tips and tricks of how to care for your lacerations and your perineum after having a baby. After we have a baby, you can either have a laceration, so a natural tear between the vagina and the rectum. It could be an episiotomy, so a surgical incision, or you can be what's called intact, where you had no lacerations. But all of the things after having a baby vaginally, there is certain things that we can care for this area after having a baby to enhance healing and decrease the amount of pain and discomfort that we're feeling after having a baby. The first thing that we're going to do is have some sort of pad or mesh underwear pad contraption. There is the option where you can have the adult diaper or disposable underwear, whichever one name resonates with you better. So it's a pad and underwear in one that you just wear overnight or throughout the day. It collects all of the discharge, and then you just throw it away every time you go to the bathroom. A lot of people find that it's a lot easier just to have one. They just put one thing on. It kind of holds everything in together, and it provides a little bit more support. But some people prefer the other option of mesh underwear or some sort of disposable underwear, and then you use your own like menstrual pads. You will get some sort of mesh underwear and pads from the hospital. Not every hospital will have adult disposable underwear. Gina and I both prefer the disposable underwear. We felt it was a lot easier, but there are some really great brands that have a little bit more heavy duty mesh underwear. So like Freedom, this one is like pretty heavy duty mesh underwear, as well as Bodily has like really soft ones. The next really important thing with perineal care is we want to keep the area clean and as dry as possible. Obviously, we're going to be bleeding from that area for the next 4 to 6 weeks, so keeping it as dry as we possibly can, but especially clean. But you just pushed a baby out of there, so you're not going to like use a bunch of wipes and like just wipe your vagina while it's really sore. So using peri bottles is a really gentle way to clean the area without having to use like toilet paper. Toilet paper also will just like fall apart and just like stick to you. If you are going to use anything to wipe the bottom, using something that's not going to fall apart really easily. So usually some heavy duty baby wipes or maybe some washcloth, and then just gently patting is our recommendation. But using them along with some peri bottles. We prefer the peri bottles that have this angle at the bottom versus the one that you'll likely get from the hospital birth center that is just a bottle, like a squirt bottle, because you have to kind of like do gymnastics after having a baby to spray in the actual perineal area. Whereas this one, it's very easy. It aims directly to the area that you're wanting the water to spray in. With the peri bottle, some people will wait to use it until after they go to the bathroom and pee. But if you have any sort of tears, the peri bottle can be really beneficial once you start to pee, because the pee is acidic and can cause some burning as you're peeing. So the peri bottle can help dilute the amount that it's going to cause some burning, which no one really wants. So using the peri bottle as you're peeing and then also to gently cleanse the area is really beneficial. I find having a peri bottle that has a larger capacity, especially for the first few weeks postpartum, can be beneficial, because I usually would go through like 2 of the smaller ones, but only 1 of the larger size ones. So Bodily has a really large size one that I enjoyed, but Freedom also has really nice ones, and you can find them on Amazon as well with this angled bottom. With the peri bottles, you just fill it up with some warm water from the tap. And some people will even make like vagina tea out of like some Sitz bath herbs and steep that in hot water, and then put the hot water once it's cooled into their peri bottles. So you're getting some of the soothing and healing elements of the herbs as you're doing your peri bottle gentle washes. That's not a requirement, but it's sometimes nice. Next, we're going to try to think about inflammation. So the area is going to be very swollen. So we want to try to decrease the inflammation, because that's going to help with a lot of the pain. So there are 2 things that we can utilize to help decrease the inflammation. There are Tux pads or witch hazel. They're kind of all similar things. They're like cooling pads. That's going to help decrease the amount of inflammation that's there. And it just feels very nice. It has a very nice cooling effect on the bottom. If you have hemorrhoids, they're also really great for the hemorrhoids. The other option are ice packs. Ice packs can be really beneficial for the inflammation for the first 24 to 48 hours because it's going to decrease the amount of blood flow going to that area, so it's going to lead to less swelling. But we don't want to use the ice packs for longer than 24 to 48 hours because that could actually impede healing. So we want to limit the ice packs to just the first 1 to 2 days. They have really nice ice packs that come in and it already has a pad on it so it can absorb some of the discharge, but they don't absorb as much as a regular menstrual pad would. So putting this inside of like the mesh underwear with the diaper can be beneficial to kind of decrease the amount of mess that's involved. They also have ice packs that are reusable. So they have like this little sleeve that you can put into your like diaper so that you get the ice pack, but less mess. The next thing that we can think about is decreasing the amount of pain as well, aside from just from the inflammation and swelling, is just some numbing sprays. So there are two main types of numbing sprays given at different hospitals. There is the Dermaplast. This you can even just get on Amazon. It's just first aid antiseptic, but it kind of helps numb the area and soothe the area. Or in some hospitals, they'll give you what's called EpiFoam. So dependent on the hospital that you're delivering at, but what they're doing is causing some numbing to help decrease the discomfort that you're feeling and can be really nice. We don't normally recommend using this with an ice pack because it could cause some numbness, and then the cold with the numbness could cause some damage from it being too cold. Then last, we're going to think about things that are going to aid in the healing of our lacerations or any just episiotomy tears or any sort of tears at all. And that's where perineal balms or sprays come in. These have like healing properties that can kind of, one, not just soothe the area, but can enhance healing. So there are different brands out there that have different perineal sprays. There's perineal foams. Both Gina and I have used like this essential oil type of blend that was made by a birthing center that I delivered at. And we found that the sprays are really beneficial for the first couple days, but if you had stitches, once you're out of like the first couple days, the stitches can start to get really itchy, and that's where the balm can be really beneficial. But the balm can get really messy. So we preferred the sprays for the most part, but the balm could be beneficial if you do get that itching from the stitches as they're starting to kind of dissolve and heal, and the spraying isn't really helping with the itch. They also just smell really nice. So it has healing properties and it smells nice. Another thing that we can do to enhance our healing are sitz baths. So sitz baths is when you either just sit in a basin of warm water, or you can fill your bathtub up with a little bit of warm water and you sit there, and this is increasing the amount of blood flow going to your bottom. We can enhance the sitz bath though by adding in some herbs or some salts to kind of enhance the healing of our bottom, and it's also really soothing. So you can again just get like sitz bath herbs or sitz bath salts on Amazon, or there are like lots of companies that make them. I got them from my birth center and I felt that it really was beneficial and helpful. It's also helpful if you have hemorrhoids. So just to recap, all of the tips that I recommend as a labor and delivery nurse for your perineal care is getting some sort of mesh underwear or diaper contraption, having a really cool peri bottle that you can utilize really easily, having some ice packs or some witch hazel to help with inflammation, and then things for soothing. So that's from numbing sprays, some perineal sprays or the perineal balms, as well as some sitz baths can be really beneficial. We'll put all of the links to the products that we have both utilized and recommend to our clients in the notes below. If you have also given birth and you have different perineal care tips, leave them in the comments below for others to read and learn from you. If you're looking for more support during your pregnancy, check out our online childbirth education course where we discuss the science of labor and birth to decrease the amount of fear that we have going into birth. We find that when we understand what's going on, it makes it less scary. We also discuss different birth options as well as a little bit of postpartum prep. We also have a prenatal fitness program to help decrease the amount of pain that you're experiencing and prepare your body for labor and birth. And we also have postpartum education courses of what to expect in the postpartum to help prepare for that as well, and postpartum fitness courses. And you can check out all of our offerings on our website at MamasteFit.com and use code YouTube10 to get 10% off any of the offerings. We also have bundles where it's an additional 15% off the bundle. And with that 10%, it's like 25%. So it's basically so much savings, it's free. If you enjoyed this video, please like and subscribe to our channel so you can be notified whenever we release new videos. We release 2 educational videos and 1 workout video a week to help support you in your pregnancy, birth, and beyond.